Well, first off, welcome everybody. Just let you know we are recording this call. So with that, good afternoon, everyone, and welcome. I'm Scott Van Den Berg, President of Century Management, and I'm glad you've joined us today for this program on 2025 changes to Medicare and what you need to know. We're fortunate to have with us Jamon White, founder of Four Oaks Medicare Planning. Jamon's one of those rare experts who can take something as complicated as Medicare and make it simple, easy to understand, and manageable. And at Century Management, we've referred many clients to Jamon and his partner and wife, Paula, over the years, and the feedback has consistently been very positive. People really appreciate how they help them sort through their Medicare choices and the mechanics of enrollment. Even my parents, Arnold and Eileen, have taken the services of Jamon and Paula and have really appreciated their guidance. So now that we're heading into another Medicare enrollment season, Jamon's timing really couldn't be better. He gave us a Medicare presentation actually on this day last year, and it was very well received. So we wanted to invite him back to share his thoughts with us again. And as I said just a moment ago, we are recording the call. If you want to hear a replay or share it with somebody, it'll be on our website either by the end of the week or say Monday at the latest. You just go to the www.centman.com website. On the top toolbar, it says webinars. Click that, and it'll be front and center. The program's going to last about 45 minutes. Jamon's going to first start talking about just kind of the basics of Medicare, and then he's going to get into the changes and trends that he sees now and over the coming years happening with Medicare. So if you have questions along the way, just type them in the chat box, and then when he's done with the kind of formal presentation, we'll save 10 or 15 minutes for Q&A at the end. So with that, let's welcome Jamon as he walks us through the basics and trends of Medicare. Jamon, welcome.
Thank you. Thanks, Scott. I appreciate the time to be able to come and just share some insights a little bit on Medicare and the program and what we're also seeing, like you mentioned, the trends and where things are headed. Just a little bit about me, I'm founder of Four Oaks Medicare Planning. I mean, we just do Medicare all day long. I am a former lawyer. I got my law degree at University of Texas. We are all AHIP certified here. Just means we pretty much can do anything when it comes to Medicare. We're a licensed and independent insurance brokerage, so it just means we don't just work with one company. I have a lot of experience in corporate benefits, HR, just in previous positions. So we try to go as in-depth as you want, when it comes to Medicare and how it impacts you in different situations on where you're at with approaching Medicare age, retirement, still working. Those are all really important things to be aware of. So I do want to just kind of remind everyone, we're going to talk about the basics of Medicare. We have a lot of different people on this webinar, so we want to start from the same educational viewpoint. So I want to talk about the basics a little bit, because that's what's going to allow you to kind of set in context about what things are so that we know how those things may be changing and what the trends are. So just set a little foundation here. I always put this little cartoon screen up because this is what we deal with every single day. If you're approaching Medicare or you're even already on Medicare, you're getting inundated with information from every which way. You don't know whether to turn right or left or go forward. And the minute you make one direction change, you feel like you're stuck against a wall and you need to back right out. So we're here to be Medicare partners, to help you navigate this system so that it's a straight shot. You get what you need done so that you can move on with your life, and that's way more fun than talking about Medicare and looking at 14,000 different options and plans. So with that said, let's dive in a little bit on the basics. So, everyone should know or may be familiar with Medicare. It is the program predominantly for those that are 65 and older. And original Medicare is the foundation of the program. You'll probably recognize the little picture of the card. That is what you get when you go on to original Medicare, and it's divided into two parts, Part A and Part B. So just remember, A is called hospital insurance, but it is your inpatient benefit. You spend the night in the hospital, it's going to activate A. On B, it's called medical, but just thinking outpatient. Doctor visits, MRIs, even chemotherapy on an outpatient basis activate Part B. So remember, they work together, and it's really important for in most circumstances when Medicare is your primary insurance, you're going to need both of them. Now, remember, Medicare does not cover everything. The number one problem with original Medicare and why it's important to pay attention to what you get in the mail from all the different insurance companies because of satisfying this number one problem. There is no out-of-pocket maximum. Medicare doesn't cover all of your costs when you go on to it. Medicare also doesn't cover prescription medications. That's under Part D as in David. So it's a completely different part of Medicare. Routine dental, glasses coverage, hearing aids, remember those are excluded from Medicare. Long-term care, do not think Medicare is a long-term care program. Just as a reminder, it's not going to provide you long-term custodial care. You'll have to look at separate policies like long-term care insurance or maybe even Medicaid planning for that type of coverage. And original Medicare does not really cover you outside of the United States. It is a federal program. So we'll be getting updates within the next couple of months of what is happening to the cost for Part A and Part B. Since we're still in 2025, just as a reminder, Part A usually is premium free for people that have at least paid into the system over their working life of 40 quarters or 10 years. But after that, if you have Part A, there are out-of-pocket costs when you're accessing care. So there's a deductible. It's a little under $1,700. Just note as a reminder, it's a per benefit period. What does that mean? It means you can hit the Part A deductible more than one time a year, just depending upon the length of time from which you are discharged from the hospital and go back in. If it's outside a 60-day window, you're going to pay that deductible again. There's definitely per day costs if you're in the hospital for longer, and then you'll note the no out-of-pocket limit. Now, the Part B, this is the one that is the outpatient benefit. As a reminder, its base price is $185 per month for most people. Remember, you can have an income-related adjustment that will increase your Part B based upon your income. We'll talk about that in the next slide. But just as a reminder again, when you access medical care under Part B, there is an annual deductible. This year it's $257. And then generally you are responsible for 20% of most covered services under Part B. That coinsurance amount sounds pretty normal, for any sort of health insurance that you might have through your job in the past. But as a reminder, what's not normal is there's no out-of-pocket maximum. So that 20% could be 20% of $500 or $500,000. There's nothing that caps it. And so again, that's why it's important to remember that Medicare A and B just serves as the foundation of the program. There's other things you definitely need to look at in order to complete your Medicare coverage, particularly the lack of the out-of-pocket max. So I did mention the income-related adjustment. It's called the IRMA. This is something for planning purposes. It's very important to remember as you're maybe thinking about going on to Medicare. It is essentially a surcharge for higher income earners, and it can be a little tricky. So I want you guys to kind of look at this chart with me. You'll see at the top right, it says you pay in 2025. And if you look down that column, you'll see the base price of $185, and then it increases based on certain income thresholds. The key though to this surcharge is look at on the left-hand top. You see it's asking for your modified adjusted gross income in 2023. So remember that your IRMA is going to be based upon your modified adjusted gross income from 2 years prior. So just remember in 2025, they're looking at 2023. In 2026, they'll go up at the next year and look at 2024. Whether you're an individual filer or a joint filer, just be aware that those are where the income thresholds are, and the IRS is just going to send that over to Social Security, and they're going to surcharge you if you fall in any of the income brackets above the base price. So it's really important to note that. Now, there is a way that you can get out of the IRMA sometimes earlier than waiting for it to phase out over the next couple of years. Let's maybe say you're retiring, or maybe you lost your job. There is a form that you can see on the governmental website, Social Security. And what that's going to show you is it's going to give you the applicable ways that you can argue or appeal it, right? So just be aware that that is something that you can try to do if you fit in one of those categories. This next slide is just a reminder that the Part D plan, which is prescription medications, is also surcharged based upon your income. It's the same sort of thresholds, but you'll just notice that your Part D is impacted as well. So just remember, Part B and Part D are affected by being a higher income earner. So I always like to go through just some important reminders or pitfalls, what you need to understand when you're approaching Medicare or you're working past 65. One of the most common questions that we get is, well, what do I do with Part B? I do not want to be I don't want to have a late fee, right? I don't want the lifetime late penalties. So it is true that if you do not go on to Part B when you're first eligible, you could be subject to a 10% penalty for every 12 months that you did not go on to Part B when you were first eligible. But notice it says unless you have qualified other coverage. And that's a key distinction. Most of the time, that qualified other coverage is going to be in the form of employer insurance. So again, another very common question is, Jamon, I'm employed. What do I need to do with my Medicare? And it's really important to remember that it depends upon the size of your employer. That is key. If you work for a company that's 20 or more employees, Medicare is actually designed to be secondary to that employer plan if both are in place. So what that means is your employer plan's not going to change. It's going to sit primary. Medicare, if you have it, may offer some secondary coverage. So this is a situation where if you make a determination that Medicare is not going to be as good for you, the employer plan might be a better option for the time being. Maybe they cover a lot of your premium. Maybe you have dependents, a spouse that's not quite Medicare eligible and needs to stay on that employer plan. You can delay Medicare. You're not going to be penalized as long as you're an active employee and continue to have that coverage. Now note on Part B that you see less than 20 employees, it flips. And this is where there's a lot of confusion because it flips. Medicare is designed to be primary with a small group employer plan, and the small group employer plan is designed to be secondary to Medicare. What does that mean? It means that if you work for a large group employer, Medicare recommends that you go on to A and B. Why? Because you want to avoid any potential gaps in your coverage because, again, Medicare is designed to be primary. So that is a very important distinction to always remember. Now let's talk about one area that sometimes people will do. If they like, this is the large group employer plan, 20 or more employees. If you decide that you want to keep with your employer plan, remember Part A is premium free and it sits secondary to the large group employer plan if it's there. Many people will decide to do Part A and delay Part B because remember, that's where there are monthly premium costs. Well, most of the time that's a good thing. But if you are on a high deductible health plan that's HSA qualified, HSA meaning health savings account, and you're going to continue to work and you want to continue to contribute to that health savings account and enjoy the tax benefits that you get, you're not going to want to go on to Part A either if you have that large group employer plan. Why? Because if you go on to any part of Medicare, you are no longer eligible to contribute to that HSA. And then also note that Part A can go retroactive when you want it to start. So a prime example of a situation of planning is if you, let's say, work and you're about to turn 67 and you're ready to go on to Medicare, you've been contributing to your HSA account all the way up and you're ready for Medicare to begin. Be aware that Part A is going to go retroactive back 6 months from when you want to go on to A. So that means technically any of those HSA contributions that fall within that 6-month window are no longer eligible. So you would want to stop your HSA contributions 6 months prior to when you want A to go into effect in order to avoid those contributions deemed ineligible. One last note, A will never go retroactive past your Medicare eligibility date, which is your 65th birthday month. So just be aware of that you don't have to stop HSA contributions 6 months before you're Medicare eligible because Medicare, you're not going to be eligible for Medicare until you turn 65. COBRA. Let's talk about COBRA real quick as well. That kind of ties with the employer insurance, remember, because it's pretty much a lot of times your same plan. But just be aware if you're with a large group employer and your employer plan is primary, if you elect COBRA and you're allowed to take COBRA, it switches. Suddenly Medicare is primary and COBRA is secondary. So really, I just want you to remember COBRA is not a friend to Medicare. You can have them, but you need to go on to A and B if you're going to have COBRA. So I just want you to remember there's some things like COBRA, HSAs, employer plan size. Be proactive in figuring out what you need to do rather than reactive, because it definitely can cost you if you don't understand the rules. So let's visit really quickly. We've talked about Part A and Part B and that lack of out-of-pocket maximum. I want you to be aware of, in general, this is how we deal with that main problem. There's 2 options you choose from. You can choose a Medigap plan to deal with that, or you can choose a Medicare Advantage plan. All the companies have their offerings, but it really just comes down to 2, which makes it more easily understandable. So what's a Medigap plan? A Medigap plan is where you stay on original Medicare and you pick a Medigap, or it's known as a Medicare supplement, to fill in those gaps we talked about under A and B, the 20% of Part B, the deductible under A. So remember, it's really important to understand the Medigap. And so this chart will just break it down a little bit further. At the top, there's letters. That's the type of Medigap that there is. And then on the left-hand side, there's the benefits. Those are all those gaps we talked about, like the 20% under B. You'll see that on the 3rd row down, a little bit lower, Part A deductible. That's going to be that little under $1,700 deductible. Those are the gaps that a Medigap plan's designed to fill. And if you go to the column G and just, let your eyes go down that column, you'll notice that most things say 100%. And that just means that's how much of the quote gap that G plan's going to pay for you. So again, if you see the Medicare Part B coinsurance of 20%, that G plan says 100%. It's going to pay all the 20% for you. Part A deductible, the same thing. You'll notice under the G plan, it's pretty much 100% all the way down until you get to a blank. If you see where that is, it says a Part B deductible. Remember, that's the $257. So your coverage can be almost 100% utilizing Medigap. So it's very, very comprehensive and very flexible. You get to go anywhere Medicare's accepted. Now, the G's not the only one. There's other ones there, but you get the idea of the benefit of a Medigap plan and the flexibility that it gives you by being able to go pretty much anywhere in the United States for coverage. Now, I do want you to see the other side, which is Medicare Advantage. Those are more like if you've worked in the past and you have an employer plan. A Medicare Advantage plan is very similar to those type of plans. It's also known as Part C of Medicare. What are these plans? They're kind of all-in-one plans. Everything's bundled together. They're managed care plans where you have networks, like a PPO, HMO, but they're going to bundle everything like your A and B, the inpatient, outpatient services, the Part D, prescription drug plan. They'll even offer some additional benefits, potentially like dental and vision. But the key is they all have out-of-pocket maximums as part of them. So again, you get protection there under the Medicare Advantage Plan Part C program as well. So they are different in how they work. And so I'm not going to read this verbatim, but I do kind of want you to just make sure that you understand the differences between the Medigap, or known as the Medicare Supplement, and the Advantage plans. So always remember, coverage-wise, remember the Medigap plan is nationwide. You go anywhere Medicare is accepted. And so it's very, very flexible and very comprehensive. Remember, we saw that your hospital medical coverage can be almost 100% with a Medigap plan. Medicare Advantage plans are more network-based. They have the provider networks. They have an out-of-pocket max. You're likely to have a copay, coinsurance when you have a Medicare Advantage plan. Cost-wise, under the Medigap, you're going to pay an additional monthly premium for that coverage. Part D, as in for the prescriptions, you likely have to add it. So it can be more costly on a monthly basis just in premiums, where a Medicare Advantage plan, many of them have little to no premium, but you're going to pay as you access care in the form of copays and coinsurance. So anyway, they work very differently, but they both offer you the protection of not having the unlimited liability that comes with original Medicare by itself. So we've hit on Part D a little bit. I've danced around it some, but we've already know how do you get a Part D drug plan? How do you get your prescriptions covered? And we've already kind of talked about that in how you get it. You get it in two ways. You usually get it as a standalone plan if you've exercised the option to go on to the Medigap side, or it's usually bundled in with a Medicare Advantage plan. So that's typically how you will get that coverage. Now, I do want you to know that prescription drug coverage under Medicare, as you may know, is different than what you find a lot of times in the commercial marketplace. You have phases of coverage that you go through. So just always remember, you can have a deductible phase you have to satisfy before you go into the next phase where you may have copays or coinsurance. The third phase is catastrophic, which is something that's new for this year, where all of your medicines, once you get to the catastrophic phase, are covered at 100%. So drug plans, which one's right for you, is a calculation in, well, what drugs do you take? Because all drug plans have different formularies, where your drug is in the tiers. The higher the tiers, the more you pay. So it really is an individual calculation on what drug plan coverage is best for you, because it's going to depend upon your medications themselves. So we're kind of coming towards the end of kind of this basics round. I always want to remind you that your Medicare initial enrollment window is always around your birthday month. It's the 7-month window that you become eligible. 3 months before your birthday month includes your birthday month, and 3 months after. If you're born on the first of the month, it shifts to 1 month earlier. But if you're on Social Security, you're enrolled in Original Medicare automatically. If you're not drawing Social Security, you have to go to Social Security and do the enrollment. You can pick Medicare only. You can delay your Social Security benefits and go on to Medicare, or you can take it all if you feel like that's the right way to do it. Now, remember, many people work past 65. That's absolutely okay. Just remember the caveats that we talked about earlier. But you have an 8-month window to go on to Medicare from when your employment stops or your employee coverage stops. I will tell you though that this 8-month window, you're not really going to want to enroll in Medicare during that time. You're going to want to do it prior to month 1. Why? Because if you're losing your employer plan, you want the transition to be smooth where there's no gaps. So typically it's a planning exercise of getting everything in place so that once month 1 hits, all of your decisions have been made and your coverage is all in effect. Note that there's a second column here that there's a different enrollment window for Part C and Part D. What does that mean? Talk to somebody as you're approaching retirement, or if you're working past 65, your deadlines, depending upon what you need to do, are different. So just be aware of that and start and reach out if you have any questions on that. Now, one of the things you're going to see that's coming up within the next month is the annual election period. I always like to mention this because it's where you see like every commercial on television about Medicare. This annual election period runs from October 15th to December 7th. It's really the window of time that the government gives you to change, enroll in, or disenroll in your Part D drug plan or a Medicare Advantage plan. If you're still working and you have not yet gone on to Medicare, this enrollment window is really not for you. You have other windows like we just talked about that are special enrollment windows that will open up. And then finally, the general enrollment window that you see on the right-hand side, you don't really want to find yourself in here, but if you have a friend or maybe you haven't made the right decision and got confused and you didn't enroll in Part B when you were first supposed to, you do not have the ability to go on to Part B at any time. You have a 3-month window that starts in January and ends at the end of March. If you call in April and you don't have a special enrollment window or initial enrollment window to open up, you're out of luck until the following January. So we're coming up on the general enrollment period, so just be aware if that's applicable. But usually this is where you're likely going to be subject to the late enrollment penalties since you don't qualify for a special enrollment window and you're outside your initial window. Okay. Well, I went through that a bit more quickly than normal because I wanted to really get into the upcoming changes and trends that we're seeing. This is a little bit of I call it the behind the scenes curtain. We're going to open it up a little bit to talk about what you should expect to experience, or maybe you are already experiencing in the Medicare market right now. This is going to help you understand why. Okay, so there's some charts here, and I'm just going to break them down real quickly because, you know, Medicare is funded by the government. Medicare Part A is mostly funded by payroll taxes. And then Part B, a lot of it you'll see on the second chart is general revenue. So the government and taxes and all that play a really important role in the big picture of Medicare. Now, as you probably already know, the population is aging, but I just want you to focus on the growth rates because you'll see those that are working, paying the payroll taxes, funding the program. Look at the annual growth rate. It's about 0.3%. And then there's projections there. Now, if you look at the Medicare eligible on the top, you'll notice that growth rate is much higher, 3.1% in the past, 2.3% going forward. Well, you can kind of see what that means. There's pressure on the system. The 65 age population's aging into Medicare at a faster rate than the younger demographic growing. And so that's going to cause pressure on the Medicare program, particularly as utilization increases. So here's one of those things that maybe sets it in a little bit even clearer. Notice people aging in between from 2020 to 2060. That gives you an idea of the growth. So as participation increases within Medicare, it's naturally going to lead to either increase in costs for seniors or reduction in benefits or even tax increases because a lot of that's funded that way. So what does that mean on a very short-term basis? Well, it's very similar to what it's meant in the past. We don't have exactly what the numbers are going to look like for 2026, but I do want you to pay attention to just some of the projections. So in 2025, you'll notice the Part B premium is $185 a month, not counting the income surcharges. It's projected to go up by about 12% to $206.50 per month. Now you'll notice there's some other increases in there where they're likely going to adjust the Part B deductible and other things. But just note that, these changes do happen every single year. And we're going to start, continue to see these changes where you'll notice in 2021, the Part B premium was back at $148.50 a month. So those are some small changes. But I want to also start introducing you to some other new things that really has not happened with original Medicare before. So one of the primary complaints that you hear about on Medicare Advantage, remember that's the managed care program that we're kind of used to, is all these prior authorizations, things that you have to get permission for from the insurance company. Well, prior authorizations, at least to a limited extent, are coming to original Medicare. There's a demonstration program that's starting in January 1 for certain states. One of those states is the state of Texas. Now you'll see what the list of states are on the slide, but you'll notice that this means that there's certain treatments that are coming that Medicare is going to require prior authorizations for. We're not quite sure exactly how the program, in actuality is going, this demonstration program or pilot project is going to work. But just be aware that this is just another sign of the pressure that Medicare is under, and now they're trying some, I want to say, cost containment measures that haven't been a part of original Medicare in the past. It's kind of reaching into it, and Texas is one of those. So if you're on original Medicare and you fall within one of these categories, just be aware that you might find that there's a prior authorization requirement there that might not have been there in the future. Medicare supplement rate increases. Remember, these are the Medigap plans that we talked about. These are very, very popular, remember, because original Medicare, you go anywhere Medicare is accepted, and then you're able to have almost 100% coverage. So it's really a unique benefit that you've never had before, during your working lifetime. So with that said, though, over the last few years, we've had some very different economic conditions. We've talked about inflation a little bit. Going to the grocery store a couple of years ago, the price of eggs right off of the bat started to be adjusted up. Well, that's starting to make its way into the Medigap plan loss ratios, right? COVID as well was something that caused many people not to go in for their elective surgeries for a year or so. People, many times rightfully so, wanted to stay away. So that was kind of a great thing for insurance companies, right? Because utilization was lower. Well, we're now in a post-COVID period. Utilization is going up. Inflation, medical inflation is a thing. Has been going up. Well, over this last year or so, those increases in costs and claims have to work their way through the system because all of these companies have to go to the Department of Insurance to get their rate increases approved. So you'll notice we had a relatively stable time period in the Medicare supplement market over the previous 5 or 6 years. You'll see from 2016 to around 2022, but notice 2023, especially 2024, and now coming into 2025, we're seeing rate increases come in. We're seeing some rate increases between 10 to 20%. This chart recognizes rate increases through Q2 of 2025. So that just means I would think this chart is actually gone up a bit more. What does that mean? It just means that you may want to shop your Medicare supplement potentially, but there's not a lot of places to hide. But it is something that we can talk about if you're interested, but just be aware that this is what's causing these rate increases. I'm hoping over time that things will start to level off because I do think the COVID period introduced some different dynamics that aren't typical normal economic cycles, of course. So I'm hoping that we'll start to trend, and this is just playing catch up to maybe the years that we would have seen prior increases, maybe if COVID had not been a thing. So, but key thing is Medicare supplement rate increases are common. If you find yourself getting that rate increase notice, you're not alone. The Inflation Reduction Act, was passed in 2022 and really affected the prescription drug program a whole lot. The reason it did is it changed the Part D program in a very big way. And in 2025, that was one of the biggest things that was implemented. You'll notice there's the $2,000 out-of-pocket max for Part D. This is something that is really wonderful for people that take really expensive medications because prior to that, it was a hardship for people under the Medicare Part D programs because there was no cap on their cost during the year. And so we've had that happen, and so it has been a good thing. Notice also in 2026 and beyond, you'll see Medicare is now being able to negotiate using its buying power on certain Medicare Part D drugs. So we're hoping to see some lowering of some of the costs of some of the more expensive medications that in the coming years. 2026 is the first year we'll see the impact on the first 10 medications. Those have already been negotiated. 2027 will introduce another 15 drugs and so on. So when it comes to Medicare prescription drug negotiated prices, here's the list. This is the first set of prices, or at least medications that were subject to that. So if any of those on the left-hand side you take, be aware you might be able to get a bit better deal than maybe you have in the past for those. I will note on the right-hand side, there of the 15 drugs in 2027, Ozempic is one that comes up a lot. That one's one that was subject to negotiated pricing. So we'll see what this looks like for 2026 and 2027, but just be aware that there's definitely changes that are coming on the negotiated pricing front as well, subject to the Inflation Reduction Act. So I mentioned the Part D out-of-pocket max of $2,000. Again, I mentioned that was a huge benefit for people that take really expensive medications. But I will tell you that it has affected the Part D drug plan in a major way because of who is funding or taking on the burden of the catastrophic coverage, right? So I want you to just note real quick, just at the top of the line of each of the two graphs. In 2024, take note, the catastrophic coverage, 80% of the drug costs were being borne at that level by Medicare itself. So the government had much more liability in funding the catastrophic coverage for those very expensive medications. But note what happened in 2025 on that top line of who is having to be subject to the liability of the catastrophic phase. It went from 20% in 2024 for the Part D insurance company drug plans. Now they're shouldering 60%. So that's a huge, that is a huge increase going from 20 to 60%, and the government has shifted 80% and they're down to 20%. Well, remember, the money has to come from somewhere, and so you'll notice in 2025 it's coming from the drug companies. Well, back last year, during the election year, I say election year in particular just because I think this was a surprise to the government about what was happening, because they introduced a stabilization program, CMS did, the government entity in charge of Medicare. And essentially, the demonstration program provided extra money to these drug companies to reduce the amount of increase in premium that they were seeing these drug companies have to do in order to absorb the increase in their liabilities. So that demonstration program is continuing for this year, but it's being funded at a lower level. So what does that mean? It means that be on the lookout for your drug plan. Be on the lookout and note that the demonstration program is not, those Medicare Advantage cannot participate. It's only standalone drug programs. So when you have that liability shift, just be aware that, well, Medicare Advantage plans, if you have one, you may see a reduction in benefits as, again, they're trying to fund the increased liability in the drug costs. Or you might see an increase in your drug plan premium. Now, we're not sure, again, the extra money is helping to keep the blow from being too much. That's the purpose of the drug plan demonstration program. So just keep an eye out, because that's going to be very important for how the drug plan program is changing from year to year. Okay, we're getting towards the end, but I did want you to kind of look Medicare Advantage plans. Many people are on a Medicare Advantage plan. You'll notice on the left-hand side, the enrollments on Advantage plans are going up and up and up. And I just want you to kind of say there's a mixed outlook of what may be happening in 2026. We'll know more when plans are released next month. But just kind of be aware that there's a lot of positioning happening with the different companies. On the right-hand side, this is just kind of a glimpse of what happened last year. You'll notice United Healthcare picked up a lot of business. Humana did more of a shading off of some of their business. And of course, there's other companies that grew as well. I have some certain headlines down below, and I do want to make one caveat. This is not a dig on United Healthcare. Some of these headlines last year would have had Humana in them. It's really just what's going on in the current market environment right now. Again, you notice United Healthcare picked up a lot of business last year, and now you'll see on the left-hand side, there was news articles that they're dropping a lot of their Medicare Advantage plans. And in the middle, they're seeing some of their stock plunge, and they're attributing it some to the utilization, the higher costs. You know, so what does that mean? Does it mean that United Healthcare is a terrible company? Absolutely not. It just means there's always positioning going on, and that ultimately means you need to pay attention, right? Be proactive, knowing that United Healthcare, Humana, Aetna, they're all dealing with these market dynamics of increased utilization. That's not just a thing that United Healthcare is experiencing. That we've seen is happening on all of these plans. Now, on the right-hand side, the reason I say it's a mixed outlook is you'll see that the government is going to fund Medicare Advantage plans at a larger rate or an increase than they did last year. So there's a lot of competing factors. And so what this boils down to is, of course, Medicare changes are always coming from year to year. And you just want to stay informed. You don't want to be reactive. You want to be proactive. And as the annual election period is coming, this is the time period where you can be proactive. So seniors on Medicare Advantage plans or have standalone drug plans, usually with the Medigap, you need to be ready for plan changes in 2026, just so you know if you need to make any changes or not. Annual notice of changes, or what are known as ANOCs, you may have already gotten that in your email or through snail mail, but that's going to tell you what is happening to your Medicare Advantage plan or your drug plan for the upcoming year. Be on the lookout for that so that you're not wondering what happened to your plan in January. Know now so that you can make changes. Okay, well, I'm going to open this back up to Scott for questions, but I do want you guys to know that we put out a survival guide every single year. And if you want that or look at any articles or videos, you can go to our website, go4oaks.com. We do put out a podcast as well, just again, keeping people up to date on what's going in the Medicare market throughout the year. This is our contact information. You can always reach out to us by email, call, or visit our website. We are local to Austin, but we work all through the state of Texas, and we're in about 30 states as well. So we're here to help navigate Medicare for our clients. Our services are always free to you. So just be aware that being an independent brokerage, we're able to really be your advocate. And so with that, I do want to honor the time, Scott, and just open it up to any questions anyone might have. And then, of course, if you want to take it offline, you can definitely reach out to us via the contact information on the screen.
Great. Thank you, Jamon. That's great. A few questions. So for two related to travel, if people travel within the United States, is there better coverage for Medicare Advantage since it's or original Medicare, given that one is more network based and one is not? Part two to that is, what about people that travel internationally? If they're going to Mexico, Caribbean, Canada, Europe, should they get travel insurance? How can you just address the travel issues?
Sure. So yes, there is no network with the Medigap plan, so you get to go anywhere Medicare is accepted, A and B. So that's within the entire United States. So it is more flexible because your coverage under original Medicare is the same whether you're in Texas or California, and then the Medigap plan just goes right along with you and pays the most of the remainder of the claims. When it comes to Medicare Advantage, it depends upon the company and the network that you have. Of course, if you have a PPO, many times it's more of a nationwide network, but that can differ from state to state. If you have an HMO, a more closed network, of course, you need to be aware that that might be a more narrower network, though you always have safeguards in all of these plans, just like you do with most insurance. Usually if you need urgent care or you need emergency care, you're going to have coverage under those plans, usually wherever you are. When you're traveling outside of the United States, original Medicare really just does not have hardly any coverage at all. But Medigap plans, certain of them do have a foreign travel emergency benefit that is a part of some of those plans. And that's the same thing with a lot of the Advantage plans. Usually it's a reimbursement scenario, but I will tell you that it's really to stabilize you, and then you're going to want to get back to the United States. A lot of times, the most expensive thing when you're traveling abroad is evacuation, medevac, I mean the airline ride, things like that, if that becomes an issue. Those types of things you're not going to really get coverage on Medicare or I think even the foreign travel. That's when you might want to, if you're concerned about something like that type of situation, a temporary travel policy usually is going to be designed to cover those types of things. And so that's what I would recommend that you move toward. Don't really expect Medicare to play a huge role in overseas travel health insurance coverage.
Okay, so would you say for somebody who doesn't really travel out outside the US, they're not even really traveling much outside of their state, just on taking that question by itself, would Medicare Advantage maybe be a little cheaper on the premiums for someone that doesn't travel as much because they can be in a closed network within their state versus people that travel a lot within the US on original Medicare?
Oh, right. I mean, again, the flexibility of original Medicare is key for those that do travel around a lot and
Okay.
want, the flexibility of that. Medicare Advantage, yes, on a monthly basis, many times, many of those plans have little to no additional premium costs. So they definitely on a monthly basis can be less expensive, but just keep in mind that the more you access care under an Advantage plan, the more you're going to pay out of pocket because you will have the co-pays, co-insurance types of things under like you would under a traditional health insurance plan. That's number one. Number two, be aware that the network that you're in, you may not have access to the certain specialty hospitals that you might really want in case something happens. I'll give you one example. Obviously this is time stamped for September 17th, but MD Anderson, that's a cutting edge cancer treatments, things like that. Most of the Advantage plans are out of network with like MD Anderson. That may or may not be true in the future, but if you really want access to very specialized places, it doesn't mean Medicare Advantage won't give you access to that, but the likelihood that those specialized places will drop an Advantage plan is a lot higher than them dropping original Medicare, the entire federal program. So again, the flexibility of where you access care can be very different between an Advantage, which is the network-based plan and is subject to the contract negotiations between the doctors and hospital administrators and the Advantage plan company itself, versus original Medicare where everything's pretty much set and they just have to work within that system or they have to come out of it completely.
Great. What would you say are the biggest mistakes people make when enrolling in Medicare for the first time, or maybe even considering changes? What are the common mistakes that you see?
Right. I mean, some of the common mistakes are just not reaching out and really understanding the Medicare system and what choices you have when you're first eligible. One thing that I was on the slide, but I didn't really zero in on is the Medicare supplement open enrollment period, those Medigap plans. When you're going on to Medicare for the first time or going on to Part B for the first time, you have a window of time where, like that Plan G, you can pick any of the Medigap plans that are open to you. There's no medical underwriting. So you have the maximum flexibility of picking Medigap if you want, or you can pick Medicare Advantage. You want to know about both. The reason is usually once that Medicare supplement open enrollment window closes, it's a 6-month window. Like in the state of Texas, sometimes there can be different rules in other states, but like in the state of Texas, once that closes, you're likely you'll be subject to medical underwriting if you want to get a Medigap plan in the future, save except maybe limited guaranteed issue exceptions that you may qualify for, but those are very limited. So I would just say overall, you want to have a complete picture. If you think you know a lot about Advantage but not about Medigap, you want to know the rules and how they change over time to make sure that you're not missing out on something that you might have looked back 2 or 3 years and go, oh, if I would have known this, I would have picked another option, but now maybe due to your health status, you're not able to do that. So I would just say knowing the rules and being informed and educated is key. That way it'll make sure that you're making the right decision for you, whether it's Medicare Advantage or Medigap.
So Jamin, so along those lines, thinking about the different insurance companies to choose from, whether United Health or Aetna or what have you, that can get a little overwhelming with all the nuanced details of the plan. Is that something that you help clients go through to evaluate? Is there like you do a little bit of an interview with the clients and their personal circumstances, and then you know enough the details to say, well, based on what you told me, I would recommend this coverage over that? I mean, can you talk to that for a moment?
Sure. I mean, that's exactly why we exist. We do this every single day where we're talking with people and really educate you on Medicare, and in bite-sized chunks because we know that this is not what you do what you're wanting to focus on full time. So we just do a step-by-step process where we're evaluating again understanding what how the Medicare system works, and then, yes, we go into specific options. That's why we're independent. So we work with all the different insurance companies and we try to tailor exactly what you're wanting your Medicare to do for you in terms of cost, of course, but also coverage. And then that way, we always tell people, our job is not to just enroll you and forget about you, because we always follow up with all of our clients because we want to, we're very relational. We want to walk with you through your Medicare lifetime. But one question we never want 6 months into your enrollment is, if I would have known this, I would have done something completely different. That's why we spend time really making sure that you have a complete picture, and then we go down specifically to where you don't have to look at 40 to 50 to 60 options. We're tailoring it down to one or two based upon what your needs and desires are. And then that way you're just making a very educated, informed decision so that you're very satisfied. And that's what we find, Scott, is people that are pigeonholed. A Medigap person that's pigeonholed into Advantage, if they call a call center, are the unhappiest people on the planet. But that's vice versa. Someone that's pigeonholed into a Medigap and really should be an Advantage, they're mad too because they don't want to pay the premiums. They like the Advantage system. So we make sure that we place someone in the right spot, and then we just help service things over the years, and as we need to make changes we can. But it's from a standpoint of being educated, not not understanding the process and just feel lost. That's our goal, is to that never to happen.
Sure. And then when clients get their annual notice of change in September, is there anything that they should look for first specifically, or?
Well, the annual notice of change is really, I think it's great because it literally has a column for 2025 benefits and a column for 2026 benefits. And you just want to compare them and make sure that you don't see anything that jumps out at you that goes, oh, wow, that's something that's going to be a problem for me. That's what you want to see so that you can make changes during that time period so that you're ready to go for 2026.
Okay, and then can you just go over one more time the difference between the enrollment period, that October 15th through December 7th versus the January through March?
Yes. So, yeah, the annual election period, October 15th to December 7th, is available to everyone in whether you want to change, disenroll, enroll in Part D or Medicare Advantage plans. You can change those on a yearly basis. So that's just the time period where you're given to make those elections. It's like an open enrollment window that you would have, like if you're in your job and every year you have a chance to make a change if you want. This is that. The general enrollment period, remember, is really for those that did not enroll in Part B when they were supposed to, and they didn't continue working. They don't have a special enrollment window. That's just a hopefully very small segment of the population that maybe didn't plan or maybe got bad advice. They can enroll in Part B if they're past 65 and don't have a special enrollment circumstance. They can enroll in Part B during those first 3 months of the year, just so that they can get all of their full coverage with Medicare in place.
Great. Well, Jamon, I think that seems to be kind of clear out the questions through the chat, and we're coming right up on 1 o'clock. So I think we'll stop it here, but thank you very much for your time and expertise and sharing all that you have with us today. It's no matter how many times you tell me, I always pick up something new. So it's great. And remember, for those of you on the call, it has been recorded. It'll be on our website by Monday at the latest. So thank you very much, everybody, for your time to be with us today. And Jamon, thank you again very much for all your help.
Absolutely. Thanks for
All
having
right,
me.
take care. Bye, everyone.